Guys, this is Martin, the hemorrhoid expert, and today I'm going to talk to you very briefly about bleeding hemorrhoids. A lot of people want to know what bleeding hemorrhoids are, what causes bleeding hemorrhoids, so we will go ahead and jump right in. Typically, bleeding hemorrhoids are associated with internal hemorrhoids, so oftentimes one of the first symptoms or the only symptom you'll actually have with internal hemorrhoids is bleeding. And if you don't have bleeding, sometimes you'll have an internal hemorrhoid and you won't even realize it. So a lot of people will use the bathroom if they do have the bleeding symptom for their internal hemorrhoids, and they will see blood on the toilet paper and they start to worry because bleeding in the bowels can be a sign of other serious problems. But usually it's an internal hemorrhoid. So if you do have bleeding down there, when you're using the bathroom, oftentimes it's an internal hemorrhoid. You should still get checked out by your doctor because it could be something more serious, and it's important to take a look at and make sure you get that checked out. But typically it's an internal hemorrhoid that's bleeding. So we'll go ahead and take a look right here. You can see this is an internal hemorrhoid and you see the blood there. And when you pass a bowel movement, that blood gets pulled down, and when you are wiping, that's where you'll see the blood on the toilet paper. So that's a very common sign of an internal hemorrhoid. So here's a graph or a diagram which shows hemorrhoids. And as you can see here, this is the internal hemorrhoid. And when the internal hemorrhoid comes down and pushes outside the anus, it's a prolapsing internal hemorrhoid or a prolapsed internal hemorrhoid. These often have more symptoms than just the bleeding, but you can frequently experience bleeding with them. So we will move on. This is a thrombosed hemorrhoid. Now, a thrombosed hemorrhoid is a hemorrhoid that has developed a clot. Okay, a clot is basically this hard lump of blood that gets pooled in there. One frequent treatment method for thrombosed or clotted hemorrhoids is rubber band ligation. And essentially what the doctor does is he puts a tight rubber band around this, which cuts off all the blood supply and basically shrinks and gets rid of this. And oftentimes you'll go in for the procedure. It'll take they'll put the rubber band on. It takes 7 to 10 days, and typically you should be fine and good to go. Now, there are some natural ways you can help your internal hemorrhoids or external hemorrhoids in the bleeding. You can use a soak in a bath for about 15 to 20 minutes. Oftentimes soaking in a bath can help with the bleeding and help stop the bleeding. You can also use an ice pack. I would definitely recommend using hemorrhoid wipes when you're using the bathroom. You don't want to use rough toilet paper if you have bleeding down there. It's just going to aggravate things and make things worse. And then also, this is a fantastic product for hemorrhoids, which you can get on Amazon. It's called Hemorrhoid Plus. It's a hemorrhoid supplement that has a lot of great ingredients like witch hazel, which is commonly used for hemorrhoids. So you're absolutely going to want to check Hemorrhoid Plus out. So yeah, that's basically it about bleeding hemorrhoids. If you do have a thrombose, that's something that you're going to want to go see your doctor for and potentially have that rubber band ligation done. Minimally invasive treatment. Like I said, use a ice pack. Definitely jump in the bath for 15 minutes and soak a little bit. That'll make you feel better. So I hope you enjoyed this bleeding hemorrhoids video. If you have any questions for me, feel free to comment below. I'm happy to help. This is Martin, your hemorrhoid expert.